a Black woman with a college degree or an advanced degree is more likely to die from childbirth or childbirth related issues than a white girl who has not finished high school. And we seem not to be getting the message, because every time I tell a group of women that, they're surprised. And all of them sitting there usually have 1, 2, or 3 degrees.
No, it doesn't matter. And I mean, I had great insurance. To be honest, I think I paid $50 to have my son. Yeah, I said that 50. The first copay. And because I was 35, I had to pay another copay for that test, to go to the specialist.
The advanced maternal. Advanced maternal age.
I paid $50, y'all, and I nearly died twice. And so, you're right, Joy. It does not discriminate, and that is why advocacy is so important. I remember after my 5th miscarriage, my husband and I said, we're good. That we may adopt, or we don't want to have any children, and which was heartbreaking for me. And a friend of mine said, LaToya, go to this doctor. She specializes in high-risk pregnancy.
Welcome to the road to Soul Joy Wellness, where a coach and a therapist explore the journey to living your best life on purpose. Here are Joy Williams and Nadine Huesner, your host.
Hello, Nadine.
Hello, Joy. New day, new start. I'm super excited.
Yes, it's a new day. It's definitely a new day, and it's a great start. So I'm excited about this talk because we are focused on Black Maternal Health Week, which is April 11th to 17th. So we can, of course, celebrate outside of that, but we really want to focus on that during this time. And one of the reasons that we want to do that is this helps to give us a focus on reducing disparities and increasing outcomes for Black women and our babies. So I'm excited also because I have LaToya Dennis. So I had been working with her on the Moms Tour, which she is producing, and she has a great story to tell, and she's done so many things. So the Moms Tour is part of her effort, and she's the CEO of Motivated Mom, and we're going to hear so much from her. So she'll tell us the story. So let's welcome LaToya.
Good morning.
Thank you so much for joining us this morning.
Thank you guys for having me this morning. That's an inside joke.
Yes. So really,
I'm be here, Joy. I am.
I appreciate it, and I appreciate all that you do and learning about all that you do, because it's so much. But just to get started, can you tell us about what your Motivated Mom platform is in general?
Absolutely. And so, excuse me, the Motivated Mom, I am the Motivated Mom, initially started as a blog, helping moms be present in their children's lives. It was all about my epic fails as a mom, honestly. And after a few years of blogging, I decided to implement programs in the community for moms, self-sufficiency programs, mompreneurship programs, maternal health programs, and put all of it under my nonprofit, which is A Chance to Learn. So I am the CEO of A Chance to Learn. That is the home of the Motivated Mom. That makes sense.
Wow, that sounds like you're doing great and impactful work in your community. Wow. And definitely talking about, and we talk about being those epic fails as moms, it's something that I think everyone tells you about all the things you can do and be as a mom, but they never really highlight or point out the failures of motherhood.
I mean, it doesn't come with a book or a guide. You just kind of learn along the way, and understanding that some moms didn't get to be a daughter, right? And so it's hard for them to navigate motherhood when they've never been on the receiving end, right? And so the Motivated Mom was created for that purpose.
Wow, that's incredible. So as a person who is not a mom, so what do you think of as epic fails as moms? And what do you think kind of pressure that is?
We don't have that kind of time, Joy.
That's so good. Tell her, Nadine. It is.
Is there one? And there are multiple. I'm going to say, LaToya, even from my own experience, when you said there aren't books, there are books, but they are rainbows and unicorn books that tell you about the beautiful things about being mom. But all of our failures, there are commonalities, but I think ultimately there are uniquenesses to it, right?
Yeah.
Because you have these ideals in our heads, and I can always parallel it, for you, Joy, the single dating person, about you envision what it should look like in those relationships, but the reality of it is something completely different, and you look around and you're like, well, why is everybody else getting it? But it's not that everybody else is getting it, it's that everybody else is just looking like if they're getting it.
Yep, that's absolutely right. Like it, and I say there's no books, and obviously there are, but I meant when you have that baby, there is no scenario the same.
Mhm.
My experience is completely different from yours, and our children are completely different. God didn't make us the same. That's why we have fingerprints. Like everything about us is so unique. And so parenting is a unique experience for each of us. And so helping someone to navigate through that is really what, the Motivated Mom is about. And my epic fails, it's being a workaholic, right? I talk
Mhm.
about, one time my son, I had worked all day, at the office,
Mhm.
and came home and was working still. And I don't know, he may have been about 4. He said, he's talking to me and I'm talking back, but I'm working because at this time I worked for a very aggressive ministry, and you had to be on all the time. And so I'm working on my phone and I'm looking down, but I'm talking to him. And he says, Mommy, talk to me with your eyes. Yeah.
Sounds the babes, they say. So
Yeah. And so epic fails is unique for
Mhm.
everybody. But for me, it's, slowing down and being present in the moment. And
Mhm.
so all of those things became a part of the things that I share through Motivated Mom. So
Mhm.
they're unique to me, but I'm pretty sure it's benefiting someone.
my word of the day is Jeremiah 29:11, and I share this in so many different versions, but this one's a message version. I love this. I know what I'm doing. I have it all planned out. Plans to take care of you, not abandon you. Plans to give you the future you hope for. And this is such a great quote for this conversation. And then we are in partners with the Lord in getting the future that we have hoped for, and God wants it for us.
My quote of the day is, there's a level of racial bias within our healthcare system that is troubling and will be difficult to tackle, but that doesn't mean that we shouldn't. Allison Felix. And she was an Olympic champion in track and field, and three-time world champion, two-time Olympic silver medalist, and world bronze medalist. And guess what? Fun fact. In 2019, Allison Felix testified on Capitol Hill about the importance of overcoming the racial disparities in the nation's maternal health and mortality crisis following her own life-threatening experience.
Yeah.
It sounds like it must from the stories, and then just the stories and the help. Then you decided to do programming. So how did that come about that you decided that you wanted to do the programming?
Big heart. God just gave me a big old heart. But seriously, it really is. I'm a servant leader. The Motivated Mom platform had grown so fast. Sometimes you can grow faster than you mature. And in some areas, I feel like that's what happened. But on the flip side, I was making so much money that I just did not anticipate making. And
Mhm.
so I decided I want to do some good. So I just launched the program in the community. I'm the Motivated Mom, and brands are paying me to do this, that, or the other. why don't I invest in other moms so that we could all become present and live a life of purpose and fully engaged and financially free? And those are the components of Motivated Mom. And so I just took the proceeds, went knocking on doors in Bonton. And I don't know if you guys know anything about Dallas, but the Bonton community is a low-income community in South Dallas. I just started knocking on doors. Hey, I'm a Motivated Mom, and I'm doing programming every week in the community center. Join me. And it started with 7, and then, 18, and then 36, and it just kind of grew. And that program has been in the community since 2017.
Wow.
That's great to hear. And there's so many things that you said there. So one, you were using your expertise, excuse me, that you're using your expertise from your corporate experience to build your business, and what so many other mompreneurs and other Black women entrepreneurs want to hear. You were making a lot of money, so I'm sure people want to hear from that. But you also, as a servant leader, decided to give back. So that is the great story to hear, or to live a life of service, because it's not always, it's like to serve. So that those are great things to hear. So what was the key, do you think, in you figuring out how to make a business that made you money?
That's a great question. Because I completely feel that it was on accident. Honestly. That's the way that I feel, but I do think that God is in control of everything, and my story of becoming a mom, that journey for me was just so hard that it was my why. It's my reason of, so I had no idea that the Motivated Mom would grow as fast as it did. But when it did, I've always been a servant, a chance to learn. We started by providing funds for women fleeing domestic violence, and we paid for their childcare because we know that that was one of the number one reasons they go back to their abuser. And so that was our very first program. And then we get a call from DISD, Dallas Independent School District, saying, hey, we understand you're all about early childhood education. Can you do something? And so we have always been in response to a need for the community. So when the Motivated Mom platform kind of grew so fast, it wasn't, I don't even remember the process of me saying, I want to do something in the community. I just did it and started knocking on doors and used my own money for years that I made to implement those programs. And for me, I feel like that's just, I'm an ordained minister, but I'm not a pulpit preacher, if that makes sense. I minister in the community. And so this was me doing that. And I've done that since, early 20s as a minister, right?
So you spoke about being a servant leader, right? And that balance between being servant leader and mom, right? Because being a mom is also a very personal servant leader. How do you balance those two? How do you incorporate those principles? How do you create balance in your life as this servant leader with your family and being a mom? Like, you were doing great work, labor intensive work, right? Spiritually rewarding, but also can be depleting work. So how do you create that balance as a mom?
That's a great question, Nadine. And I think it's something that a lot of moms struggle with, right? And the guilt that comes along with you being away from your children, or feeling as if you're giving so much to other moms that you're missing the part of being a mom. And it can be a challenge, right? And for me, it probably was for years. In all honesty and transparency, I don't know that I got that right.
Mm-hmm.
I can't say that I did. I just know that I really did focus on my responsibility as Chance's mom. Now I have 2 boys, but my responsibility as Chance's mom, and to the best of my ability, be present when I needed to be present. And then when I was working, I do that, right? But creating balance was something that was really hard for me up until recently. I don't know that I think I got it right. I mean, he seems to be okay, but you know how children are, they don't always tell you. And
Mhm.
so I think creating balance, if I'm honest, I just don't know if I got it right. I did my
Mhm.
best to be present. And that's what I talk to other moms about. In the moment, be present. We even created a retreat for moms because I felt like we needed to take time to retreat. Because when
Mhm.
we're at home with our children, we need to be present. And so starting things that's going to help even me balance out, but definitely be have my first ministry be at home, if that makes
Mhm.
sense.
Setting those
And that retreat, it
priorities.
sounds like a bit of self-care. So Nadine and I really like self-care. We really focus on self-care. So
Yeah,
that seems like a great thing so that we can make sure that moms are involved in the self-care as well. So
I think you guys should join me, Joy. You're not a mom, but the Motivated Mom Retreat is about the village of moms. It's about the auntie moms and the cousin moms, excuse me,
Mhm.
and the community moms and the foster moms, right? Because that's my story. You know,
Mhm.
I grew up with several moms, and and they were all very. Ooh, I don't want to get emotional, but anywho, the
They were
Motivated
there.
Mom. Yeah, Motivated
Mhm.
Mom Retreat is really about the village of moms. You don't have to have birthed a child to come. So I
Mhm.
invite you. And you guys should probably, we need to talk about that because the retreat, it is definitely about self-care. We talk about things that are important to moms. We definitely do maternal health, breast cancer awareness, all the things we touch on, but we really do retreat in the packages, and it's very affordable. Shameless plug. I'm sorry, we're talking about maternal health, but this is about maternal health
It
because
is
we
about
have good
maternal
it
food,
health. Yeah.
right?
This is no shameless
But
plug here. This is what it's all about. Like giving,
love it.
like hoping that the listeners, when they walk away with some real tangible tools, some, purpose, meaningful direction on how they want to be. When you spoke about the balance of being, balancing mother, I say, I have 2 children, but I'm married, so I say I have 3 children. And being able to balance all of those relationships, right? So I am a therapist. So, I go, my work is to really, be a part of someone's journey in their journey of healing, of self-actualization. I'm not here to fix nobody, but I am part of that journey. And that takes a part of you, right? And it's
Hey,
for me, I have to create a structure like this time and this time, this is what I focus to this. And I don't let the two get mixed. If I'm on a session, I do mostly telehealth, and my kids know when that door closes and that noisemaker goes on, unless the house is on fire, no one knocks. Like everybody gets it. And vice versa. When I'm with my kids, I set my phone to, do not disturb. Like that's their time. I cannot be distracted. I'm not so rigid where, there are times where I don't allow things to kind of seep in, but it's really about adding structure that my time for work and, you know, helping others is that time I give 100%. And then I have to give 100% because at the end of the day, as a mom, my goal is to give this world healthy, well adjusted people who can contribute to the greater society. So if I fail on that, y'all all in trouble. Y'all in trouble. That's all I gotta say.
Yeah. Hashtag facts.
Uh-huh.
Yeah, absolutely. And that sounds amazing, Nadine. I love that you've created that and have been able to communicate that with your family, because that's the other part is sometimes we think that we have to dictate and I have to create balance like this. But sometimes it is a conversation with our family of what balance looks like, what works for us,
Mhm.
because we are on the go. You know, I
Mhm.
joke with my sisters and say, you know, when Chance was a baby, because this has always been my life, right? Go, go,
Mhm.
go, always doing. So when he was a baby, I joke with my sisters and say, oh yeah, I mean, he need to be tying his shoes by the time he's 9 months, because who has time for that, right? And so, you know, I used to always joke about stuff like that. And so it's funny because now they're like, yeah, Chance is so adjusted to like, oh yeah, we're doing that tomorrow. Okay, cool. Like, let's do it, right? And so sometimes we create what that looks like for our families, and moms need to know that you determine what balance is for you, because no one can tell you that. No one can tell me, oh, you're doing too much over here. Now you have no idea what happens in my home.
You have no
Mind your
idea.
business and drink your water. Okay.
Go sit down
I
somewhere.
love you.
Listen,
But you know, it's interesting that you said, like, you know, how you said Chance had to tie his shoes. My thing
before he's
was
9 months, like I didn't have time.
my kids had to learn how to buckle themselves up in their car seats. I'd be like, you know what you need to do. And I would forget if I have somebody else's child and they're sitting there waiting for me to buckle them in a car seat. I'm like, y'all didn't tell them? You gotta
True.
learn how to buckle up your own car seat, right? If you can talk, you can buckle.
Yeah,
So
I love it.
Yeah,
I love it.
I love that, LaToya, because I think oftentimes as a person who does a lot, people are always trying to tell me I do too much. I'm like, I'm doing what I want to do, and I do like time by myself and time alone and all that stuff. But that's not how I'm wired to just spend day in day out by myself. So that is great. So people need to find it for themselves, the level for themselves, because it might not be the thing for the other person. So I think that is
Oh,
great to hear.
absolutely.
Yeah,
Yeah.
that's great
Yeah.
to hear.
And those are the things when you asked the question earlier, those are the things that contribute to epic fails, right? When we are trying to do things based on what someone else said motherhood is, or what we should be doing, or how should we act, or you know what I mean? I think that's how we create the epic fail is for years I was trying to be the mother that I needed, right? As opposed to being the mother that Chance needed, right? Epic fail,
absolutely. Mm-hmm.
epic fail, because I needed to be his mother.
Mm-hmm.
It was my mom needed to be my mom, right?
Mm-hmm.
So I needed to be his mother, and trying to be the person that you needed in this situation, even in business. I used to think, yeah, that's what I want to be. I want to be the person that I needed.
Mm-hmm.
No, I need to be
Hmm.
the person that he needs, my Chance needs as a mom. And so, you know, you learn as you go and then you pivot. You know, it's kind of like faith. You know, you turn right and go straight.
Mm-hmm.
You know, you want to get to heaven, turn right and go straight. Want to be a great parent, turn right and go straight. Like it is that simple. I mean, I wish it was, but
Yeah.
you know what I mean? That's the philosophy is you turn in your direction according to your path that God has given you. Because that call, your inspiration for your company, Joy, that wasn't a conference call, right? There was nobody else involved. That was you and God knowing that this is what I'm supposed to be doing. And it's the same with parenting. It's your lane based on what he's called you to do, and everybody is going to parent differently according to that. And I think for me, it is again having 5 miscarriages and within 2 years and being told, you know, Black women have miscarriages all the time, try again. Black women have miscarriages all the time, try again. And the fifth one nearly killing me. Had I made it 5 to 10 minutes later to the hospital, I probably wouldn't be here with you guys today. And then, nearly dying postpartum, it really does give a perspective on the blessing that you have in your children and, being alive to raise them. Like in this day and age, maternal health at an all-time high, especially for Black women. Um, it'll put some perspective on your motherhood or parenthood journey. And for me, it definitely did. It weighed heavy.
That definitely had to have weighed heavy on you to just go through the 5 miscarriages in 2 years is incredible in itself. And we've talked, so I've heard your story before, and that the reality because you've lived some of it. But I think oftentimes people don't. And even when we talk about maternal and infant health, people are always thinking that the people who are most vulnerable and at risk are people who have low income and low education, and that is not the case. It's all Black women. So a Black woman with a college degree or an advanced degree is more likely to die from childbirth or childbirth related issues than a white girl who has not finished high school. So and we seem not to be getting the message because every time I tell a group of women that, they're surprised. And all of them sitting there usually have 1, 2, or 3 degrees. So the degree, the education, the income is not protecting us.
No, it doesn't matter. No, it doesn't matter. And I mean, I had great insurance. To be honest, I think I paid $50 to have my son. Yeah, I said that 50. The first copay. And because I was 35, I had to pay another copay for that test, to go to the specialist.
The advanced maternal, advanced maternal age.
That's it. I paid $50, y'all. And I nearly died twice. And so you're right, Joy. It does not discriminate. And that is why advocacy is so important. I remember after my 5th miscarriage, my husband and I said, we're good. That we may adopt or we don't want to have any children. And which was heartbreaking for me. And a friend of mine said, LaToya, go to this doctor. She specializes in high-risk pregnancy. And so I went to visit, and in my first visit, she called my former doctor and said, hey, I'm here with LaToya. Did you happen to do an autopsy on the fetus to determine why she was miscarrying so much? And his response to her was the same as to me. No, Black women miscarry all the time. I just told her to try again. And first of all, I did not know that they could do a autopsy on a fetus from a miscarriage. It's like, what? What? And so I talk about that now because we don't know. And advocacy is very important, but you have to know how to advocate for yourself and what questions to ask. And then the other thing is after a series of tests, this doctor determined that I was miscarrying because my body was not producing progesterone, which in the first trimester, the baby needs to live. That progesterone pill, though, I mean, the best sleep ever. Like, no wonder moms are tired during that first trimester because that progesterone sleep aid like no other. Melatonin has nothing on it. I mean, but the point is, how often are folks miscarrying and they've never known why? No one has ever tested. And so we have to share our stories because I had no idea that lack of progesterone could be the reason for 5 miscarriages. And
Yeah. And I had I had a journey to motherhood with losses. And yes, on that first loss, Joy gave me those stats, right? And of course, right, it doesn't matter your income, it doesn't matter what your circumstances are, that your statistics or chances for having a child are that of someone with, someone of another ethnicity with lesser education. And when I had that first loss, I asked the doctor, well, what is the reason? And they're like, oh, it just happens. Like everybody was just so nonchalant, right? And I'm just like, um, hey, and I had a 5 month. I was 5 months. Like this was not an early. My losses did not happen early. Not that that makes it easier, but I had to go through labor for this. So I was like, everybody's a little more flippant and nonchalant about this, and other losses. And my second loss was at that point too, but I became my own advocate. Like, they wanted to shrug their shoulder and say, well, yeah, that's what happened. And I found a high risk specialist and I was like, here, where we going to be? We ultimately had to go through the IVF route. And you got the pill, they had me the injection. My husband was very happy injecting me with that doggone big needle, but that's another conversation.
Sorry.
um, you know, it's I became my advocate. I told my doctor that I will be at the high risk specialist because they said I had an incompetent cervix, right? And that why I couldn't carry. But then I had, I was having challenges conceiving, so I was at that high risk specialist every week. I was like, measure my cervix, measure my cervix. They ultimately put me on bed rest. I was on bed rest for 6 months, measure my cervix. I was like Norm in chairs. Like I'd walk into the office and be like, hey, like the nurses knew me. When I delivered my daughter, one of them, their mother was a knitter, knitted her a little blanket. Like I was my advocate. I was a familiar face in that hospital because I was there every week because I wasn't trusting them because at the end of the day, those were my tears. It was nobody else's tears. So you're right, knowing and being aware and just not accepting their answers about, oh, this happened. And about that, we keep these things a secret that it wasn't until I had my loss that the aunties and the mother, my mom is like, oh yeah, that happened to me. And I'm like, whoa, no one ever said that. Like you just hear that people get pregnant, they have babies and they go on. And it's like, it becomes a secret amongst women about these losses. And I think if we are more open and vocal about, these things do happen and, create that community of support, but encouraging them, ask the questions, yeah, low progesterone, low est, all of these things are contributors. I knew someone who the alkaline levels were not right and the body would just you know terminate the pregnancy. So we don't know the reason why, and everybody's journey and choice is theirs to be made because I live in Florida. So everybody's choice and path to their family planning, it's their choice.
Amen.
Amen.
Yeah.
And I think one of the things, it is important to tell the stories because when you just tell the statistics, it doesn't paint the picture, right? It doesn't, people don't know what's happening. So we tell the story. So I use the story of Serena because she basically diagnosed herself because women die in postpartum, right? So up to a year after. So Serena basically is in the hospital. So it's not a lack of access to healthcare. It's not a lack of money, but she knew her body as well. And she had a pulmonary embolism before, these things, so she had a blood clot in her lungs before. So she recognized that she did not feel well and that she told the doctors and they're like, you're fine, you're fine, you're fine. And recently I was talking to someone from my church and she was saying when she came home, she didn't feel good. So she told the nurse and the doctors, and they're like, you're fine, you're fine, you're fine. She told her husband too, you're fine, you're fine, you're fine. And she wasn't fine. So she ended up back in the hospital with pneumonia. So we have to have other people thinking, yeah, that we need to be aggressive and checking up on these things. Because I think that's the other thing about the stories that happen to people. People people are just saying, okay, there's a lot going on because you're pregnant, which is true. But when you are feeling that you're not feeling well, you need to get it checked out. Be
Oh
like
my
Nadine.
gosh. Oh my gosh. Joy, you have said so much. And the thing about it is, and to Nadine's point, this is why the Moms Tour is so critically important, is because sometimes, and I know I was this way, when I was having those miscarriages, and again, no one talked about it in my family. And so when the doctor was saying, oh, Black women have miscarriages all the time, try again. You know what? They do. We do, right?
Mhm.
And so he wasn't lying,
Mhm.
but he also didn't care enough to figure out why. And that's the part, because we internalize. I thought I was the problem. That's usually how it goes. And so if we're not sharing stories to help moms understand how to advocate for themselves and the questions to ask, and guess what? They can do an autopsy. And guess what? They can check your cervix to determine what's going on in there if there are complications for you getting pregnant or keeping the baby. When we were 3 months and after the progesterone pill, I got to about 3 months and started bleeding again. And, my husband being the trooper, okay, let's go to the hospital. We get to the hospital and they do all the sonograms and the test, and I'm cramping and it's hurting. And they said, oh, we're so sorry, but you miscarried. Um, you need to go to your doctor to get a DNC. And so we go the next day, devastated. And a lot like your office, they knew me. I was on bed rest my entire pregnancy. And so they knew me, and no one could believe it. They were like, what? So my doctor said, okay, LaToya, you know, let's just walk across the street and do a DNC. And because my husband was in the room, not in the waiting room, right? That's another thing that we at the Moms Tour talk about, and just on my platform, is helping dads to understand their paternal rights. And you can be an advocate for mom. Be in the room, right? So he was in the room and he said, can we not do that? Like, is it thinning her cervix? Like, we have no idea. This will be the 6th DNC in 2 years. Can we not do that? And she explained, well, if the sac is intact, you have to, because it could kill her. But if not, then it'll pass and it's fine. So they do a sonogram. Hospital made a mistake. There my baby was, kicking and moving.
What?
And had I walked across the street, I would have aborted my baby. And had my husband not been in the room, I would have walked across the street, because we need advocates. And
Yeah.
that's why it's important, from us with promoting doulas and midwives. Like, you need someone in the room that's going to be able to ask the questions, because sometimes we just don't. And so it really is important for us to, just to tell those stories, y'all, because
Mhm.
I would have aborted. And, I gave birth. Chance was he was born early. I had preeclampsia and gestational diabetes.
Mhm.
And so, he came early. But even with that, I was told that those are morbidities that will go away when I have my baby.
Mhm.
And so,
Absolutely.
yeah, that's what they
Mhm.
said.
Mhm.
That's what they
They're
said.
supposed to.
They're supposed to. Um, that wasn't the case. And the leading cause of death for women of color, Black women particularly, is gestational diabetes and preeclampsia postpartum, because we have our babies and because there are underlying issues in our family. We have diabetes, we have high blood pressure, because that's all that is, right? And we leave the hospital not being treated because it's supposed to go away,
Mhm.
and we get home and we die. And
Mhm.
that's exactly what happened to me. And to be honest, I didn't even know. I didn't even know what happened to me. My maternal health story has been my 5 miscarriages and me nearly aborting my baby at 3 months, right? Because the doctor told me this, and had my husband not been in the room. So advocacy with my husband being in the room. I was maybe 3 or 4 cities in the tour last year. The Moms Tour was a 2-year 50-city tour. We did 25 cities last year, 25 cities this year. I was well into the tour, and I'm on a panel, Kansas City, I'll never forget it. And there is a nurse practitioner, a Black woman, and she's sharing this story. And I'm on the panel as the lived experience. And she says, you know, gestational diabetes and preeclampsia is the number one reason for maternal mortality among Black women, and they're dying, and this is what happens. And I said, well, no, how are they dying because of that? Like, that goes away. I had that, and it goes away. And she was like, not for Black women. It's the leading cause of death, postpartum. Because, and she explained the process of what happens to the body when it is kind of resisting itself because of the high blood pressure and the gestational diabetes. And I just started to cry. And it was like the first time. And it just really chokes me up every time, because you guys, my body, I was in bed. I started seizing. I'm shaking and releasing fluid so fast. My husband, we had no idea what was happening. And we were told that, oh, it's nothing. It's just your blood pressure had gotten a little high. And thank God I made it, right? I feel, and that's another part of my why. I feel like I've got to share the story so that other moms know, because for a lot of us, we weren't here to say that those things don't necessarily go away with Black women, especially if there are underlying issues in your family with high blood pressure or diabetes. You need to be treated. And it's okay for you to say that, because at least test me before I'm released to determine if my blood pressure is still high, or if I am still semi-diabetic, or if I have those symptoms, because again, it's the leading cause of death for Black women. And those are the things that we don't talk about, right?
Yeah. You said so much there that I definitely think we should go back over that. So that is really key, because I think one of the things when we talk about maternal mortality and morbidity, so morbidity are the things that the diseases that happen after. So even if you don't have high blood pressure, or it goes away in that moment, it can come back because it's not treated. And you could have diabetes because you had it. So markers for you having high blood pressure and diabetes later, if you had it while you were pregnant, there are markers for it to come back. So you need to be tested, and you need to be treated, and you need to make adjustments, and you need to be taken seriously, and you need to be heard. So that's the thing that people are saying, that Black women aren't listened to, and they're not feeling heard. And besides not having the information. So I think those are really key things. I think there are so many stories of women who were who have had these issues, and that the income and their education were not the problems, right? That they had preeclampsia. So preeclampsia is high blood pressure during your pregnancy. So there are some positive things about that now as well. So there's some, not about preeclampsia, but ways to treat it. So they are, I know Northwell did a study, and some other people did a study, Northwell Health, which is a hospital system in New York, about taking baby aspirin, so that there is some positive impact on that. So simply taking baby aspirin during the pregnancy has helped people. But you really have to, postpartum is an extended period. Or I was listening to someone, and she said postpartum is the rest of your life. So when you think of
14 years postpartum.
Yeah. Yeah. So in that postpartum period, because people think, okay, you had the baby, you're fine, you've been kicked out of the hospital, because you don't stay there very long. But you need to to check on yourselves for a long time. And even for infant mortality, these things you need to check on. You need to check on your baby and check on, because infant mortality is counted because the baby doesn't make it to a year. So losing your baby before the year, and that's one of the reasons that I got into this space of talking about it. Because one of the things, like Nadine said, I was there with her, but I went to Columbia Business School, and about 5 years after I graduated, I knew 3 couples, either one or two, or both of members of the couple lost their babies. And going on a walk with one woman from those 3, and they weren't in the same class, they didn't know each other, they were just 3 people. And if you think about the small population of Black people at Columbia Business School, this is a high number because we count infant mortality in the thousands, the incidence in the thousands. So I was walking with her. She had a stillbirth, and telling her about the statistics again, which she did not know. So had she known, I don't know that the outcome would have been different, but she would have paid closer attention. She would have checked, because as she could have, she and her husband both had high incomes. They, the doctor, they had access. The doctor may have missed something, but she would have checked. She would have been saying, okay, these are the things I need to look at. These are the things I need to be more of an advocate for myself. But she didn't know that. So that was one of the things that we need to make sure people know.
So, the whole patient-doctor relationship, and I think definitely in communities of color, we feel, well, first of all, there's that distrust anyway in communities of colors with healthcare providers, right? And that has shifted, that's changing. But I often hear people feeling, not wanting to challenge their doctors. Well, that's, they're an MD, like you take it at word value. And, we're all professional women. And there's a statement that that I use with staff is, I trust, but I verify. There's nothing wrong with trusting someone, but you do have the right to follow up, verify, question, and ask, because at the end of the day, you're holding the basket, right? And because if you can put it in that perspective that I don't care if my doctor feels offended or, is whatever with me asking the question, remember that if this goes wrong or it goes left, those are your tears, nobody else. What you're going to get is all of a sudden, these are the statistics, these are the numbers, and nobody ever wants to be the numbers. So I want to encourage people that their voice matters, that their questions are important. And, if you can have an advocate in the room, whoever that is, it could be your partner, it could be the aunties, it could be whoever, but if you can bring an advocate in the room with you, do it, because these are your tears, nobody else's.
One of the things I like to say is your doctor is not Jesus. So for those of us who are believers, we believe that the only person who was perfect that walked the earth was Jesus. So your doctor is not Jesus. Your doctor could be wrong. Your doctor might think he's a God or she's a God, but that's not the case. We have to say,
mistakes. We overlook
they
things.
definitely make mistakes. And if your doctor is offended at their second opinion, too bad for them. But I also want to remind people that when you're getting a second opinion, you need to get a second opinion outside of the group that your doctor is in. Right. So if you watch enough medical television, the doctors gather and they have an approach. Even when they disagree, it's like, even when they disagree, they come together and they have an approach. So you need to get a second opinion outside of that group. So the approach is different. And so it's objective look at yourself. So, I remember getting a second opinion for a tooth. The doctor wanted to do a root canal and some other things on my tooth that I did not want. So when I went to get a second opinion, the other dentist is like, "Why are you getting a second opinion?" I said, well, I have a cardiac issue. So my cardiologist can explain things better to me than my dentist can. So if my dentist can't explain it to me well enough that I understand, I need to get someone else to explain it to me and to tell me if I need this process. And I didn't. So, and that's been, I don't know, over 20 years ago. And I have never had a root canal on that tooth. So I think, and in my family, we will recommend to people, you listen to this person, let's go get a second opinion. They can, and if the doctor doesn't like it, then maybe that wasn't the doctor for you. The doctor should be fine with you getting a second opinion, because you have to live with you.
Absolutely, Joy. And sometimes it's not even like a second opinion, right? Sometimes it's just choosing the right doctor the first time, right? Because maybe I don't have anything going on right now, but I'm only going to this doctor because my mom and my aunt and my cousins and he's been around so many years. Like in some of these smaller cities and communities, like this doctor is like the doctor for everybody. And I just don't want to challenge it, right? Like, I'm just gonna go. That's our, you know what I mean? That's some of the thought process. I've been to so many cities and I've talked to mom groups and talking about doctors are like, oh yeah, you know, we've been going in like my cousin and my mom and like he is like almost 100. You know what I mean? And I mean, it's like this doctor, but I don't really connect with the doctor. We don't have a conversation about anything outside of anything. You know what I mean? And so we have to understand that you can choose your doctor like you choose your friends. Your doctor should be interested in knowing about you, and there should be a conversation, and it shouldn't just be, okay, yeah, okay, and go check out. Like, no, because the way that my philosophy is the way you do anything is the way you do everything. Right. And so when you handle me like that in this instance, what's the difference when there is a morbidity?
I love
What's the
that saying.
difference
I love
when,
that.
yeah, you know what I mean? Because that's the way that I determine how you're going to handle me. And yeah, we have to pay attention to that. And I didn't at the beginning. And so now that I've walked through that process and I felt like my first doctor, I felt like I knew him, and I was just like, but you know what, Toya? There was no real conversation. It was very much the check off, right? And so no wonder Black women have miscarriages all the time. Try again, was his response because you did not. My new doctor, I go in, we're talking and laugh. Like, I mean, you guys, with the gestational diabetes and the preeclampsia, I gained a lot of weight. Okay. Huge pregnant. And just, I remember postpartum, I'm going back in to see my doctor. And so, this is a funny story. Some of you guys may have it. I don't know, but I did. And so because I gained so much weight and I had a cesarean, right? The bottom half of my stomach, like the skin was like completely dead. And it just kind of hung over my underwear. This is TMI. Listen, I'm comfortable.
It still does.
Listen, yeah, just kind of hung over. And so I didn't think anything about it, honestly, until my son was probably about 2. So I'm in the bathroom, panties and bra, and I'm getting ready, and my stomach is hanging over my panties. Okay. I know Joy is like, what? Listen, Joy, listen, I'm telling you, some of us have it. And so it's hanging over my panties. And my son walks in and he says, oh no, mommy, you tummy. Like it was devastating to him. My husband couldn't get off the floor. He was laughing so hard. And so the next time I went to my OB and I'm talking to her and I said, Dr. B, listen, like what in the world? Like this, like it's
Pouch.
dead.
They call it the pouch.
Yeah. But mine was,
It was different.
I've seen pouches. You know what I'm saying? And I felt like I've seen pouches. Mine was not that. And I was like, it's dead. I can't even feel it. Like if you touch it, like, I don't even know you're touching it, right?
Wow.
And we had a whole laugh and a conversation. And then she was like, yeah, so I do know a good surgeon, right? So we had that kind of relationship to where, and I love that because she cared, right? And so I'm always helping moms to understand on the Moms Tour and beyond, find a doctor that really care, that you can talk to and know it's not going to be like your girlfriend, but sort of. You're going to leave there knowing that She cares about you. She's taking her time. You're not a checkoff, right? You're not an invoice. You're a person, and she wants the best for you,
Wow.
or he, whatever that is. And so it's important, Joy, when you talk about the doctor and even with the second opinions, just feel comfortable knowing that you have the right to choose, and you want to feel like the person on the other side of the table, or you know doing all the stuff with your business, care about you, to care about you.
Yes, that
Yeah.
is so important. That is so important. And I think before we end, I want to talk about the Moms Tour because it is still early April. You've done a few so far this year, and you have more to go. So because people can be listening from everywhere, and we are everywhere: New York, Florida, and Texas. What people should do if they are looking to see if the Moms Tour is near them, and then also how they can get in touch with you. So if you could share
Oh,
that.
absolutely. So the Moms Tour, Joy mentioned earlier, it is the Maternal Outcomes Matter community baby shower. And it is unique because there's a lot of community baby showers, and I'm so excited about all of them. But ours is a little different, not only because we, provide the resources, not just the tangible ones, but the community. So we invite exhibitors in, health providers, health centers, daycares, etc., so that you can have access in your community because we're in and out. But we also host a panel with a OBGYN, a doula, midwife, and a lived experience talking about the very things that we spoke about. Advocacy. How can we advocate for ourselves? What are morbidities, and what are the things that we can do about the morbidities during pregnancy and postpartum? But then we also certify for free doulas in every city, because we understand that where there is a high percentage of doulas, there's a low percentage of maternal mortality. And so we want to increase the doula workforce. We want there to be more doulas, and you to have access to more doulas so that you can have that advocate, because maybe husband really don't know about the morbidities, just like you don't, right? You want a doula that do. And y'all, if you guys are like me, a doula is not someone that you get when you want to have a baby at home. Like, I thought for years, like, a doula. Oh no, no, I'm good on the doula. I'm going to the hospital. Right? Like, you know what I mean? And so a doula is not because that's misconception, lack of knowledge, right? But a doula is not that. If you're anything like me, completely ignorant on doulas. Doulas are advocates. They can go with you to the hospital. Think about it. If you are having a child and your birth, you are in labor for 23 hours. Several shifts of nurses have come through, right? But your doula is the one constant. That doula is going to be there. Doulo, that person will be there throughout the process of your birth journey and postpartum. And so we certify doulas. The Moms Tour, we are in 25 cities this year with high mortality, maternal mortality rates, and not necessarily in any order, but those cities were identified by the CDC. The Moms Tour is supported by the Department of Health and Human Services. It is an initiative that they brought together community-based organizations to partner with them to host it. It is sponsored by so many amazing partners that are funding our ability to just go from city to city to provide these resources. And you can find all of that to say, you can find out if we are coming to your city or a city near you at themomstour.info. Themomstour.info. All of the cities are there. For me, you can find me at motivatedmom.org or a chance to learn.org, but either of them will also have information about the Moms Tour. So
Beautiful.
I hope to see you in the city. And if you are coming to the Moms Tour and you heard this podcast, please see me, because I definitely want to have a special little gift for you. So please make sure you say, LaToya, I heard you on the podcast, Joy and Nadine, and please come see me if you are coming to a Moms Tour.
This is
Yeah,
That's great.
This is
I think this is so
exciting.
important
Yeah.
because, like you said, so few of us actually know about doulas, and I know some doulas I've known for years, and most of their clients were white. So now in New York, doula coverage in New York City, anybody can have a doula and it's covered, because that was one of the other issues,
Yes.
is that doulas weren't covered by insurance, so people had to pay out of
And
pocket.
not in every state they aren't still. So we're working on that.
Yeah.
You know,
Yeah.
that's that's a process. So yeah.
Yeah, so I'm excited to do that. But people who don't know about doulas will not be taking advantage of it because they're not asking about it. So
Nope.
we have to make sure that there's more information for people. So that's exciting. So this has been a great conversation. I think it's great.
I enjoyed it. LaToya, I heard such great, wonderful things about you. I feel so thankful to have spoken with you today. I feel that I am, more enlightened and aware, and I will definitely get the word out about your tour. I think it is so impactful, and the more women that know about, infant maternal health, the more people's dreams can be achieved and we create healthier communities. So you're doing God's work.
Thank you
Yes.
so much, Nadine. And you were a bonus today. So I am so glad to have met you and to hear your story and your journey. And I appreciate it because it added so much perspective for people to helping them to understand how each mom and family and child are so uniquely different, and our perception of parenting and motherhood, they're all going to take different journeys, but the outcome is for us to raise better children, right?
Absolutely.
Like we want that, and we want our kids to, we feel, at a chance to learn that children will achieve to the level of their exposure, and that is our responsibility as parents, to expose them to everything that is good and positive and helpful and educational, so that they could determine the path that they want to go as a in their career, or the service that they want to provide to their community, or the person that they want to be in life. Like that's our job. And so you're doing a great job of that. And it was a pleasure meeting you. So thank you both for having me, and a shout out to the producer, because listen, as a producer, I already know that you're the magic maker of all of this. So, thank you so much for being behind the scenes. And thank you guys so much for having me and just really honoring Black Maternal Health Week and doing this podcast. I am really, really honored to be your guest. So thanks again, Joy, for inviting me.
Oh, thank you so much. We are so honored to have you, and this is the road to soul joy wellness. So we are having joy and that touches our soul the entire time. And this is on our road to live our best life on purpose. So thank you for all who are listening. Thank you so much, LaToya. Thank you, Nadine, and thank you, Kim. So we will be back with you soon.
Thank you for joining us on this episode of Road to Soul Joy Wellness. We hope you enjoyed the show. Please leave us a review on Apple Podcasts. We love your feedback and a chance to answer your questions, and we may even share your ideas on the show. Until the next time, enjoy your time on the road to Soul Joy Wellness.